In this episode of the Nurse Practitioner Podcast, Dr. Margaret Fitzgerald discusses getting ready for the NP certification exam. I earned a graduate degree in my NP program. What do I need to get NP certified?
Oh, this is a question I'm often asked. I and my team have helped certify more than 140,000 nurse practitioners, or at minimum, help them get ready so that they could pass their boards. And we're asked this question constantly. You go through this rigorous graduate program, you earned at minimum a master's degree. A lot of you have postmaster's certificates or a second master's degree, or increasingly a doctoral degree, postdoctoral certificate, and yet you can't enter into practice. And the reason why you need to get certified is part of the idea of credentialing the profession. And part of the credentialing including the establishment of the NP certification exam. Simply put, NP certification has been around since the late 1970s, which was a little bit more than 10 years into our profession. Certification very quickly became adopted by the states to be part of NP licensure. And this is really an important point to keep in mind. Certification and licensure are two entirely different things, because certification is granted by an organization that is charged to do that. And licensure, of course, is at the state level. Now, there are a couple of states that do not require NPs to become certified in order to get a license. And at the same time, in those handful of states where NPs don't need to be certified to get a license, employers will require you to be certified in order to be hired. So in other words, certification is mandatory for an NP to enter into practice.
What is the purpose of the NP certification examination?
Interestingly, this is a question that often gets asked. Why do I have to get certified? And above and beyond that need to credential the profession, what I want you to keep in mind with certification is that it's not an artificial barrier to you getting out and practicing as an NP, but it's rather a validated qualifier of your ability to practice safely. So the purpose of the NP certification exam is to evaluate if the examinee, that would be you, possesses and can utilize the knowledge base needed to practice as a safe entry-level NP in whatever your area of preparation would be. For example, like the family NP, the scope of practice would be lifespan, and the practice setting is primary care. So the family NP exam is a test to see if you'll be a safe entry-level NP in primary care, able to take care of people over the lifespan. The adult gero primary care NP, same deal. It's primary care, but now with the scope of practice starting with the teenager. I'll give you one more example. The acute care NP, the adult gero acute care NP. Scope of practice starts with the teen, goes through the rest of the lifespan. And where's the location of that practice? The practice is largely in settings where people present physiologically unstable. The emergency department, the acute care inpatient setting, the ICU, and the like. I want you to keep that in mind when you're getting ready for your boards. Banish the idea that this is an artificial barrier keeping you from getting your NP license, but rather embrace the fact that this is a test for you to demonstrate that you are able to have that knowledge base to practice. You can apply that knowledge base. And always, when you're thinking of the purpose of the NP boards, the smartest RN in the world cannot pass the NP boards. What you have to do is think like a nurse practitioner throughout the entire exam.
What are the NP boards like?
The NP boards are examples of standardized tests. So first, let me talk about generally the two types of exams. There are teacher-generated tests You folks are outstanding at taking teacher-generated tests, even if you don't think of yourself as a good test taker. And the reason why I can say with great confidence that you're outstanding at taking teacher-generated tests is look what you've done. You have graduated from a rigorous program of study at the master's, postmaster's, doctoral, or postdoctoral level. Give yourself a big pat on the back. And teacher-generated tests, you've taken those since childhood. These are designed to a single course. They tend to have a limited focus, like it's patho or pharmacology, and it's an emphasis on specific details. However, the NP boards are considered to be a standardized test, and standardized tests are designed to cover an entire domain. The domain in this case is entry-level NP practice in whatever your area of preparation has been, global focus, and there's an emphasis on associations. And with these boards, what the exams do is they build on and expand on the competencies of the RN role, but to the highest level of nursing practice. So like I just said a moment ago, the smartest RN in the world will struggle with the NP boards. You have to think like an NP, because our practice as nurse practitioners, and I am a clinically active practicing NP for more than 30 years now, our practice and therefore our testing reflects the breadth and depth of knowledge needed for that safe entry-level NP practice.
What is the purpose of the NP certification exam questions?
The purpose of the questions on the boards is just what I was talking about. It's a measurement of the NP's knowledge-based reasoning, clinical decision-making skills in the following. Note this: assessment, so that's gathering subjective and objective information. Diagnosis, when they use the word diagnosis in the outline of the boards you go to take, what are they talking about? They're talking about coming up with a differential diagnosis for that person. Plan/intervention, developing a plan of care and intervention based on the potential diagnoses. And then evaluation. Evaluation is looking at response to care. And these are quite specifically defined when you are looking at the content outline of the NP boards. I want you to keep this in mind. Will memorizing factoids get you to a level where you need to be to pass the boards? And that's a resounding no. I will sometimes be asked by people, tell me the top 20 things I need to know to pass the NP boards. And I was like, I can't tell you the top 20 things. I might be able to tell you the top 2,000 things to know to pass the boards, but not the top 20, because these boards reflect the breadth and depth of our practice. Will possessing a deep appreciation for and the ability to utilize the science of healthcare get you to a level that you need to be to pass the boards? The answer to that question is a resounding yes.
What are the questions like on the NP boards?
The questions on the NP boards, I'm going to give you a couple of pieces of information to think about with this. First of all, when you're looking at test question types, there are generally two different types of questions asked on any exam. One will be those lower level thinking questions, and they're largely designed to assess your memory, focus on recognition, emphasis on specific details. There'll only be one correct answer. You and I cannot have a long intellectual discussion on our differences in our thoughts on which cranial nerve is cranial nerve 2. It's the optic nerve. Have a nice day. That's a fact. That's it. There's no argument on it. Lower level thinking questions where there's clearly only one correct answer. Very few of those pop up on the NP boards. Very few. And that's what a lot of people get distracted with when they're developing their study plan for the NP boards. They'll say, okay, I need to memorize the cranial nerves and I need to memorize these drugs for the given treatment of a disease. I need to memorize this. And I'll always say to people, don't memorize, conceptualize. Well, maybe memorize the cranial nerves because that's kind of sort of what you need to do in certain anatomic landmarks. But the rest, what I want you to do is conceptualize. And I'll get into that concept a little bit later. The majority of the questions on the boards are going to be higher level thinking questions. What are higher level thinking questions? These are questions put together designed to assess your problem solving skills. Remember, that's what we are. We are professional problem solvers. That's what I adore about being an NP. I listen to a person's story and I come up with a list of differentials and then I discuss it with the patient. Then we go forward with a treatment plan and then I evaluate their response to care. And more often than not, they are getting better. And if they're not getting better, then I loop back again and I'll say, okay, let's go back to figuring out the diagnosis. We need to tweak this treatment plan. I'm here for you. I'm going to work with you until you are feeling better, or I can at least help give you a degree of comfort. So we're professional problem solvers and embrace that as part of your role. With higher level thinking questions, focus on application in new situations. There's an emphasis on critical reasoning. One more time, the boards want to see what a good decision maker you are. And how do you become a good decision maker? You need to have that depth and breadth of the knowledge base that an entry-level NP in your area of preparation would have. Here's the interesting part with these higher level thinking questions on the NP boards. Usually you're going to note that 2 answers are technically correct, but 1 is the best answer. Now, is this because the exams are tricky, that they're trying to trip you up? No. Remember, one more time, they're trying to test to see if you're going to be that safe entry-level NP in your area of preparation. And we should anticipate we'll be tested at a very, very, very high level because our practice is at a very high level. How the heck then do you figure out of the 2 correct answers, which is the best answer? You figure that out by reading the narrative of the question, the story of the question. You'll often will hear people say, oh, most of the time, the story of the question, which is technically called the stem of the question, has a lot of frivolous extra information in there. Oh, no. Every single word in the stem or the story of the question is important. And you will figure out one piece there that will tip you one way or another. So you're looking and you're going, wow, the first option and the fourth option, they're both correct. They're both correct. How am I supposed to figure out of the first and the fourth option that I've been given, which one is the right one? Always go back to the stem, to the question itself, and the answer will be revealed there. There'll be some little nugget of information that they're expecting you to pick up, and therefore you're able to apply that and come up with the right answer. Most of the time, the question style will be a 4-option test item. The stem, the question itself, as I mentioned, and 4 possible choices. There's no penalty for an incorrect answer. And that's a very fancy way of saying answer every question, even if it totally is that wild guess. You're going to encounter very few questions on the boards if you're properly prepared that are truly just wild guesses. But even with a wild guess, you have a 1 in 4 chance of getting it correct. There are select high-stakes exams. This is not one of them, where answering a question incorrectly takes some points off. This is not one of them, so answer every single question. Sometimes you will find other styles of questions, and these are the minority of the questions. And more than one answer will be correct, but they will never give you a question that says option 1, option 2, option 3, option 4, all of the above. Nope, there are no all of the above. There are no none of the above questions on the boards. And if one of the questions says, choose from more than one of the following, what they'll do is they'll tell you how many. Choose 2 of the following, 3 of the following, that type of thing. Also, you should anticipate some images. On the primary care exams, it is fair game for them to include 1, possibly 2 ECG interpretations. The acute care, obviously, more on that. Psych mental health, typically no, you won't be tested on things like ECG interpretation, although there would be an expectation for you to be aware that certain meds are that are used heavily in psychiatry can be associated with certain dysrhythmias, so you do need to know that part of it. But images come up in dermatology, ECG interpretation, and X-ray interpretation largely.
Tell me a bit more about what I should expect during the NP board exam.
One point I want to drive forward here. The NP board exam experience bears zero resemblance to the NCLEX exam experience. And for those of you who might have become RNs and didn't take NCLEX, let me just go over NCLEX a little bit. I would be one of those people, but I've been an RN for many decades. So the NCLEX exam, the RN exam, what do you know about that? You sit down to take the exam. You don't even know how many questions you're going to get. You could get as few as about 75 questions. I believe the max you could get is 225 questions. And here's the reason why. With the NCLEX exam, let's say that a person is sitting down there. Again, this is an RN, entry-level RN exam. So the entry-level RN should know about IV therapy. So on the NCLEX boards, they throw the candidate a relatively kind of medium intensity question on IV therapy. The RN candidate answers it incorrectly. So the smart technology in the NCLEX exam says, whoops, we better toss this person some more IV therapy questions. Throws a couple of more questions. Oh, person gets the next 2 IV therapy questions correct, moves on. So that's one reason why you literally do not know how many questions you're going to answer on NCLEX until you're in the midst of the exam. With the NP boards, the test you sit for, in contrast to NCLEX, was predetermined before you sat down in that cubicle. It was all set. There are only so many versions of these NP boards. Some agencies have as few as 2, some have as many as 4 versions of their exams, but it was pre-set before you sat down. The majority of the NP boards are 150 to 175 questions. There's no agency that's less than 150 questions. Remember, for the most part, it's going to be that 3 hours to 3.5 hours, 150 to 175 questions. Let me use FAANP as an example because the math is really easy to do on this one. 150 questions you should count on regardless of which of the boards you sit for. The questions will take less than a minute to answer. So 150 questions, 150 minutes. 3 hours is 180 minutes. And therefore, what you're going to be able to do is get a nice buffer to go back and look at questions that you might have second thoughts on, and you'll have plenty of time. Now, all of the boards, there is no scheduled break put into your boards. And the idea of sitting there for 3.5 hours with nothing to drink because you can't bring anything into the cubicle with you, no ability to even stand up and stretch, that might be more than you can handle. And the test sites are very well set up for you to take a quick break during the boards. And if you feel like you need to do that, go to the restroom, splash some cold water on your face, use the facilities, get back and restart your exam. Please do that because you've got the wiggle room on the time. I will tell you, the clock will still run though. The clock still runs. It doesn't stop and then start back up again when you're back in your seat to test. But most people will find if they take a quick break mid-boards, they feel much, much better. Keep in mind, out of the number of questions that you are told will be on your boards, not every single one of them will contribute towards your final score. I'm going to use the ANCC now as an example. It's 175 questions. 150 of those contribute towards your final score. What are the other 25? The other 25 questions are there for test, retest, validity, and reliability, and they neither contribute to nor detract from your final score. The other part, keep in mind, you'll hear people say, oh, those questions don't count. They're at the beginning of the test or the end of the test. No, no, no. They're woven throughout the test, woven throughout. You have to treat every single question as if it counts towards your final score. All of the tests are available computer-based now, and you will get your results, pass or fail, at the end of the examination.
What is the threshold for minimum pass in NP certification?
The threshold passing score represents the absolute minimum standards that the NP must achieve to demonstrate the ability to practice the profession safely and competently. There is no set percentage. It's not like you have to score a 70% or 75% on the exam. No. But what happens is a group of content experts looks at each version of the boards and says, for a person to have demonstrated minimum competency, remember those words, minimum competency, not excellence, minimum competency, this person must answer X number of questions correct on the exam. Is there a publication of what X number of questions is? No. And unfortunately, there's been a misconception as to the fact that you only need to score, like if we're going back to referring to tests as percentage of 100%, that a lot of people will say you'll only need to get like a 68 to 70% correct to pass the NP boards. That's incorrect because that's not the way that these are scored. But where did that 68 to 70% come from? Well, if you look at something like the FAANP exams, you need to get a minimum of 500 for your score against a maximum perfect score of 800. 800 is a score that you could get. If a person answers 100% of the questions correctly, they'll get an 800. Minimum pass is 500. If you look at 500 as a percentage of 800, it's just a little bit under 70%. So people have misinterpreted that threshold of 500 as referring to a percentage of test questions correct. That is, in fact, incorrect. By the way, with ANCC, the other major NP certifier, you need to score a 350 or greater against a maximum perfect score of 500 to pass boards. With that in mind, what's the percentage of examinees who pass the exam? General rule, when we kind of toss all the NP boards into one pot, about 85% of first-time test takers pass their boards. And what does that mean then? Well, that of course means 15% fail. And I wouldn't be that surprised at this number if it weren't for the fact that everybody sitting for the boards is similarly prepared with a minimum of a master's degree, postmaster's certificate, doctoral degree, postdoctoral certificate. And I find it perplexing that 15% of the new grads are failing boards the first time around. So it's about 1 in 6 candidates will fail boards.
What will I be tested on?
What you will be tested on and this is critical to keep in mind so that you don't become that 1 in 6 people who fail boards, is the following. The walking around information, if you will, that the entry-level NP in your area of practice should have as a clinical knowledge base without needing to consult resources. I'm going to give you an example that will go across many domains of NP practice, certainly not all. An example would be recognizing that in chronic kidney disease, this is a risk factor for hyperkalemia with the use of an ACE inhibitor or an ARB. Why is that? Because what ends up happening with the damaged kidney has a tendency to hang on to potassium, and an ACE inhibitor or an ARB, potassium-sparing medication. So you've got 2 potassium-sparing situations here. This, in the day-to-day, most people can remain on their ACE inhibitor or ARB even when their GFR is quite low, as long as they maintain adequate hydration or they're not over-diuresed. That's walking around information. What you will not be tested on is lookup information. What the entry-level NP, or any clinician for that matter, needs to investigate to ensure safe practice. An example of that would be the dose of an ACE inhibitor or ARB that's safe to use in the presence of CKD to avoid adverse effects. Keep that in mind. General rule, no dose calculation, no memorizing of drug doses. You won't be asked how many milligrams per kilogram of fill in the blank would you give to a person with this situation? No, that's lookup information. You'll be given lab norms, so you don't have to memorize the lab norms. Or what you might get will be some of these clinical conditions being described in words, like going back to my example of ACE inhibitor or ARB use in a person with CKD. You might be given a verbal description of you are caring for an 88-year-old man with stage 4 CKD who is on an ACE inhibitor who now presents with an acute GI distress. He is mildly dehydrated and he's now hyperkalemic. Okay, so you can see there that there were a number of words to describe the clinical scenario, but the numbers were not given to you. My overall test taking tip is as follows. The NP certification exam tests your ability to know why a patient is at risk for a problem. So folding in what you've learned about epidemiology of disease, who's most at risk for coming down with a given disease, how a clinical problem has developed. That's where your knowledge of pathophysiology comes in. What's the most likely clinical presentation of the condition? That's where your assessment comes in with gathering subjective and objective information. And because you are a novice in your new line of work, you need to think classic presentation of disease. Why a given intervention is effective. This is applying evidence-based practice. How that intervention works with modification of disease process via lifestyle or pharmacologic intervention. What's the most likely clinical outcome? Again, this is going back to evaluation. You're gauging response to therapy. A very poor way to approach preparing for the exam in practice is memorizing information so you know what to do, but not why you're doing this. It's a very poor way to prepare for the exam. A much better way to prepare for the exam in practice is to understand concepts and apply knowledge so you know what you're doing and why you're doing it. The NPs who I know who adore their line of work, and I happen to be one of them. I adore what I do clinically. I adore what I do in my other lines of work that are not clinical as well, with teaching, consulting, writing, etc. But one of the reasons why you'll find NPs who are so fond of what they do is they generally always know why they're doing what they're doing, and they're deeply invested in knowing the science behind their practice. Keep in mind as well, in the NP certification exam, you'll answer about 135 clinically oriented questions that contribute to your final score. And given the depth and breadth of your NP practice, regardless of your specialty, you're only going to get about 1 to 3 questions on any given topic. So you might think to yourself, well, if I'm only going to get 1 to 3, let's just say thyroid questions, why do I need to spend 4 hours studying thyroid so that I have the concepts down correctly? Because you don't know which 1 to 3 questions you're going to get. Therefore, what you need to have is that entry-level knowledge base and its application germane to your area of NP practice.
What are the differences between the ANCC and the AANP FNP and the AGNP-PC exams?
All right, I'm going to talk a bit about the 2 biggest areas of NP certification right now. And with the adult gero primary care and the family primary care, you have your choice of 2 different certifying bodies. ANCC, the American Nurses Credentialing Center, and they've been around since the late 1970s offering NP certification. Prior to that, they offered a number of different RN certifications. And to this day, they continue to offer a wide variety of RN level certification exams, plus some NP certification exams. The AANP has been around since the mid 1990s, and they offer NP certification in family, adult gero primary care, and then the emergency NP exam, which is a specialty exam. You have to already be a certified family NP to qualify to sit for the emergency nurse practitioner exam. There are other qualifications you need to have as well. The AANP exam is 100% of the questions are, if you will, exam room questions. And if you recall, the AANP exam is 150 questions, 15 questions in there for test, retest, validity, reliability that don't counter your final score. So you're tested on 135, if you will, exam room questions. The ANCC boards all have a section on professional issues that AANP does not have. It's up to 15 questions or 10% of the test for family, and about 23 questions or 15% of the test on professional practice for the AGNP primary care exam. That's the main reason. The exam room questions, if you will, AANP, ANCC, you're going to get 135 exam room questions. The thing is, the ANCC exams are longer. They're 175 questions. In total, 150 count towards your final score. You will get those additional professional issues questions.
How do I maintain my NP certification?
You need to recertify for most of the certification corporations every 5 years. Here's what I want you to keep in mind. I'm not going to tell you exactly what the recertification requirements are right now, because recertification requirements change. Let's say everyone listening to this podcast gets certified this year. 5 years from now, you'll need to recertify. Right now, the recertification is a combination of continuing education hours as a general rule, and most agencies require some clinical practice hours as well. And then there are other things that you can do, such as select professional activities, publications, presentations will give you some credit towards your recertification. But what you folks will need to do, like just ironically, I need to recertify this year. You folks, and same with me, 5 years from now, will need to meet the recertification requirements for 5 years from now, not today's recertification requirements. And that's your professional obligation to keep your eye on the ball and make sure that you're up to date and what you need to do to become recertified. The agencies, when they change recertification requirements, they give a nice long lead time on it. The last time they did a major change on this, which was a few years back, with which was adding on the pharmacology CE requirement, they gave well more than a year's notice. So it's not like one day they say, okay, starting tomorrow, the recertification requirements are totally different, and then people are left scrambling to see if they can fulfill them. No. They give you plenty of time to do that. And if you want to know more on the recertification requirements, just go to the website for whichever agency you're going to certify with, and they will be able to tell you what their recertification requirements are. And I want to remind you of one more thing, is that your NP license to practice is dependent on you maintaining your certification. So it's not a one and done with certification. Oh, I did it once, I got my license, I'm good to go. No, in every state that requires certification for licensure, you must maintain that certification. And in order to remain credentialed in the system that you are practicing in, you also need to maintain your certification for that under virtually all circumstances.
How do I get ready for my NP board exam?
What you want to do as you're getting ready for your NP board exam is to make sure you know about the exam as well as you can. Take a look at every piece of information you can get from your certifying body up on the website. They tend not to send anything through the mail anymore, but it will outline the exam content in detail. That said, you're not going to be asked about every single topic that they list, but every single topic they list is technically fair game. Be very well prepared to exercise the full scope of your NP skills. So that would be assessment, diagnosis, plan/intervention, and evaluation. And if you're to break it down, assessment is typically about 30% of the exam. Diagnosis, remember what I said earlier, that's differential diagnosis, about 20% of the exam. Plan, another 30% of the exam. And then evaluate, which is taking a look at response to care, will be the last 20%. Information on the boards is generally, at bare minimum, 6 months old, and something that just happened in the last week, month, whatever, will not be on the boards. And let's say, I'm going to give you an example here. You have your board scheduled for the 15th of a given month. And on the 1st of that month, a breakthrough new med for the treatment of fill in the blank comes along. That is not going to be on your boards. It is not. Or a new set of guidelines for the treatment of fill in the blank is published 2 weeks before your boards. Nope, won't be on your boards. The boards are not that nimble, if you will, to change literally in the day-to-day like that. And what I want you to keep in mind is, let's say that you are getting ready to sit for boards and a major set of guidelines come out, like let's say 2 months before your boards. Remember, when new sets of guidelines come out, yes, we treat them with great fanfare, but for the most part, what we have are guidelines that overlap considerably with older guidelines. So you'll be tested in all likelihood on what would be, shall we say, the overlap between the older and the new set of guidelines. You want to make sure that you study with intent and purpose. Increase and secure your knowledge base first, then start answering practice questions. Please, I have counseled literally tens of thousands of people over the years to get ready for boards. I and my team at Fitzgerald Health Education Associates, we've worked with 140,000 NPs over the years to help them successfully pass boards. Have I counseled people who have failed boards? Yes, I have. What did they generally do incorrectly? They didn't work on knowledge base and clinical decision-making skills, building those up. They leaned very heavily on practice questions, and sadly, there are a lot of very poor quality practice questions out there that mislead people to think that they're ready for boards when they're not. They rush through the exam. And quite often what I'll hear from them is, wait, but I thought the exam was easy. I was out of there in under 2 hours. I could not believe that I failed the boards. So what did they do? They weren't doing the analysis and the synthesis part of the NP role. They were thinking more superficially and not at the breadth and depth that you need to think, because we're NPs. We're the diagnostician. We're the prescriber. We're the evaluator. Our role is deeper and broader than that of the RN. So please keep that in mind. If you go to my website, FAGA.com, I have a number of articles on developing a study plan for your NP boards, and including up there is an article on lessons learned from people who have failed boards, and you're going to learn a lot from that as well. So one more time, work on knowledge building, not just practice questions. And remember, this guides everything that I do when I'm working with people getting ready for the boards. NP knowledge equals NP power equals NP board success. You will be as powerful on this exam and in your practice as you are knowledgeable. And as a practicing nurse practitioner myself, I want to welcome you to what I believe is the best work on earth, being a nurse practitioner. Thank you so much for your time and attention.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.